Here we present the endovascular treatment of a basilar artery aneurysm with the novel neck reconstruction device, the barrel. The patient is a 47-year-old gentleman with past medical history of a previously ruptured aneurysm that was treated several years ago. At the time, he had a small basilar aneurysm that was treated conservatively. However, on follow-up, the aneurysm had enlarged significantly. You can see on the CT angiogram the wide neck aneurysm symmetrically incorporated between both posterior cerebral arteries, and on AP lateral there are some small lobules projecting anteriorly and posteriorly. The decision was to treat this aneurysm with the neck reconstruction device, the barrel, which is a novel stent that has a barrel in the middle and acts as a Y stent configuration, but only require one single stent. Under conscious sedation and after obtaining access in the right femoral artery and left vertebral artery, we maneuver the first microcatheter into the right posterior cerebral artery. This is a coiling microcatheter. Follow the previously stenting microcatheter. So we're going to do a jailing technique. The coiling microcatheter is advancing to the aneurysm. Once we have the two microcatheters, we advance the device that we're going to deliver from the right posterior cerebral artery into the basilar artery. The barrel should be accommodated right at the neck of the aneurysm. The device has distal and proximal markers, as well as a distal, medial, and proximal markers right at the barrel. But right before the deployment, we make sure we have the coiling microcatheter already inside of the aneurysm. On this magnification view, we are unsheathing the device, keeping the exact location at the neck of the aneurysm. The barrel should be just right at the center of the aneurysm between both posterior cerebral arteries. And here you can observe the device being deployed halfway, and the tiny markers that could be difficult to observe are right at the neck of the aneurysm, and the device is then completely unsheathed, but it's not detached yet. You can observe in this view the 4 tines at the center of the aneurysm. So once we are happy with the deployment, we detach the device electrolytically and removing the delivering wire, and then through the previously jailed microcatheter within the aneurysm, we begin the coiling. Similarly to any other coiling technique, we start with a framing coil. Once we have adequate bulks of coils, we then start filling up the aneurysm with more smaller coils. You can also observe the previous coiling for the ruptured anterior communicator aneurysm. We progress with more coils until we complete the Raymond Roy 2. The barrel device allows for us to really achieve a completely compact coil, as you can observe in this run, and the aneurysm is completely obliterated. You can see some flow stasis within the aneurysm. Right there, just the back of the aneurysm where some of the coils did not reach, but there is flow stasis, and that part of the aneurysm will eventually thrombose. Thank you.